My name is Cassandra Delecky, and my presentation is on the pathological condition of anxiety. I've personally dealt with anxiety for most of my life, so I feel like it's a very important topic to discuss for people that may be also suffering with some form of anxiety, or that may know somebody in their life that's suffering from anxiety or some anxiety disorder and want to seek help for it. I've also included this little cartoon fictional character called Anxiety Girl. Her superpower is that she's able to jump to the worst conclusion in a single bound. Thought that was kind of funny in relation to anxiety and how some people may, react to certain symptoms. Anxiety is classified into two different classifications. There's general mild anxiety, and then there are anxiety disorders. While mild anxiety can affect anyone at certain times in their lives, anxiety disorders are much more severe and can affect a person's entire life and the way that they live their life. Worrying and nervousness are normal feelings of anxiety for people in their everyday life, but the constancy and severity of these emotions and other anxious feelings is what makes up an anxiety disorder. I'll go into further specific symptoms for different anxiety disorders in the upcoming slides. The first classification is general or mild anxiety, which is the most common form. Most people will experience this type of anxiety in their life, and worrying and nervousness are the most common symptoms of this classification. Aside from general anxiety, anxiety disorders are classified in more of a multitude of categories. There are generalized anxiety disorders, social anxiety disorders, post-traumatic stress disorder or PTSD, obsessive compulsive disorder or OCD, panic disorders, and phobias. In the upcoming slides, I'll go further into detail on each one of these different types of disorders. Now I'll go into more detail about each type of anxiety disorder. Generalized anxiety disorder, or GAD, is characterized by persistent, excessive, and unrealistic worry about everyday things. People that have this disorder, they tend to be overly concerned about money, health, family, work, or other types of issues. For social anxiety disorder, this is the extreme fear of being scrutinized and judged by others in social or performance type situations. Post-traumatic stress disorder, PTSD, is a serious, potentially debilitating condition that can occur in people who have experienced or witnessed a natural disaster, a serious accident, a terrorist incident, sudden death of a loved one, war, a violent personal assault such as rape, or other life-threatening events. Obsessive compulsive disorder, OCD. Children and adults that typically suffer from this disorder suffer from unwanted and intrusive thoughts that they can't seem to get out of their heads, which basically are their obsessions, things they obsess about, often compelling them to repeatedly perform ritualistic behaviors and routines, which are their compulsions, to try and ease their anxiety that they're dealing with. Panic disorders are diagnosed in people who experience spontaneous, seemingly out-of-the-blue panic attacks and are preoccupied with the fear of a recurring panic attack. Panic attacks occur unexpectedly, and sometimes they even occur while the person is sleeping. Phobias are the last category of anxiety disorders. People who experience these seemingly excessive and unreasonable fears in the presence of or in anticipation of a specific object, place, or situation have a specific phobia. To go more into depth, there are 5 main categories of phobias. There is animals, such as snakes or spiders. There is the natural environment, which includes heights and water. There's the phobia of blood injections or injury, which include pain or being beaten. There's situational phobias, which include flying and elevators. And there's also just the other group, which includes things that can't be classified in other types of groups, such as the fear of vomiting or the fear of clowns. There are many signs and symptoms of anxiety. Some emotional signs and symptoms include constant worrying and fear, apprehension, trouble concentrating, feeling tense and jumpy, irritability, and anticipating the worst. Aside from the emotional aspect, there are also physical signs and symptoms of anxiety. These include pounding heart, upset stomach, diarrhea, tremors and twitches, muscle tension, headaches, fatigue, and insomnia. Anxiety affects a large portion of the body. This diagram shows the many areas that are affected. To start with the different organs and organ systems, we'll start with the brain and nerves. The different effects that anxiety can have on the brain and nerves are headaches, feelings of despair, lack of energy, sadness, nervousness, anger, irritability, increased or decreased eating, trouble concentrating, memory problems, trouble sleeping, mental health problems such as panic attacks, anxiety disorders, and depression, which overall is what we're covering. It can also affect the skin. It can cause acne and other skin type problems. It has effects on the muscles and joints. It causes muscle aches and tension, especially in the neck, shoulders, and back. And it puts increased risk of reduced bone density on the body. It also affects the heart. It can make a faster heartbeat, a rise in blood pressure, increased risk of high cholesterol and heart attack. It affects the stomach, causing possible nausea, stomach pain, heartburn, and weight gain. It can affect the pancreas with an increased risk of diabetes. It can affect the intestines with diarrhea, constipation, and other digestive problems. It can also put effects on the reproductive system. For women, women can get more irregular, painful periods with higher anxiety or reduced sexual desire. And for men, it can put effects on impotence and make lower sperm production or reduce sexual desire also. Lastly, it can affect the immune system, which causes lower ability to fight or recover from certain illnesses that you may be faced with. Regarding cortisol, cortisol can have positive effects on the body when it's trying to eliminate anxiety or an anxiety attack, but it can also have negative effects on the body. Cortisol is a stress hormone that's released by the adrenal glands during an anxiety attack. Cortisol levels, however, build up in the blood when they're not released in a healthy way. Ways that you can release cortisol include physical activity, meditation, social connectivity, laughter and levity, or through music. When cortisol isn't released in a healthy way, high cortisol levels may lead to muscle and bone weakness, impaired cognitive ability, excessive fatigue and weakness, obesity and infertility, high blood pressure and glycemia, depression, paranoia, and anxiety, irregular menstrual cycle in women, and also possibly a lowered sex drive in men. There are a variety of ways to help manage anxiety. These include examining your life and identifying stressors, getting enough sleep, exercising, changing certain eating habits, decreasing your caffeine intake, meditation, breathing and visualization techniques, and maybe even taking classes to help deal with situations or to gain skills in lacking areas of your life. While there is no cure to eliminate anxiety, There are a variety of treatment options. First, you should start with a complete evaluation by your doctor. Your doctor will go over your symptoms with you and they will address your medical history and look for any underlying conditions or concerns that may lead to high anxiety. You could also try behavioral or cognitive therapy, where your doctor will likely recommend a specialist for you to see. For medication, there are prescription medications for anxiety disorders, along with more homeopathic medications you could try. You could also try simple changes in your lifestyle, such as possibly switching careers to maybe a less stressful career, or even just starting a new exercise routine during the week. You can also try learning relaxation techniques, such as taking a yoga class. Anxiety can have serious effects on your day-to-day life. Some short-term effects of anxiety include extreme worrying, changes in personality, becoming socially withdrawn, trouble with work or school, trouble with relationships or family, depression, or suicidal thoughts. Aside from the short-term effects of anxiety, there are also many long-term effects that can accumulate from anxiety or anxiety disorders. These include issues with weight gain, substance abuse, memory problems due to increased cortisol release, digestive problems, heart and kidney damage, isolation from friends, lack of confidence, and unwillingness to pursue friendships or future goals. All of the information I've provided was acquired from these references and the references on the following 2 pages. Overall, my presentation on the pathological condition anxiety has informed you of the different types of anxiety and anxiety disorders, the different effects that it can have on the body, the organs, and the different organ systems, and also different ways that you can manage or possibly treat your different forms of anxiety or anxiety disorders. Hopefully my presentation has enlightened you on the affliction that is anxiety. Thank you.